Chris first.
Okay, those of you of a certain age or a certain scientific disposition may well recognise the Star Trek medical tricorder, a multifunctional handheld device which we use to diagnose diseases on hostile planets without the need for any medical intervention. But that was set in the 23rd century. Now, how are we today? Are we anywhere near the reality of a portable wireless device that you can fit in the palm of your hands that could diagnose different health conditions without the need for specialist facilities? Well, if you can make that tricorder concept a reality, then you could be $10 million richer, thanks to the Tricorder Foundation, the X Prize Foundation and Qualcomm who are teaming together to offer this substantial prize for anybody who can basically turn a device so the man on the street can actually diagnose health conditions relatively easily. Now, of course, there's been significant advances in terms of monitoring health, and there's a wide range of devices which are readily available for monitoring physical parameters. But are we really ready yet to diagnose different diseases? So can we really harness technology and use it to replace these medical healthcare professionals? Now, fortunately, diseases actually leave some traces. They have some molecular clues as to help us with this diagnosis. And, for example, the presence of certain proteins can help diagnose HIV infections, assess liver function, and tell us if we've got cancer or not. If we can detect certain sequences of DNA, we can identify bacterial infections such as meningitis, MRSA, and sexually transmitted infections. And more recently, there's been some small molecule biomarkers identified which can really help give an early diagnosis of degenerative diseases like heart disease, like certain other types of cancers, and Alzheimer's disease. But to get a medical device that can really start to sense all these different types of biomolecules in a realistic way is going to be challenging. So what we need is a biosensor. Now, a biosensor would consist of a recognition component and something that could give out a signal when the target is recognized. And ideally, we'd like this to be an electronic signal because we'd like to interface this with cheap electronics so that we can have a portable device. And it's got to be very selective for targets, so it can select one target in the presence of many other biomolecules and contaminants. And it may be difficult, but this does exist. If you think about the commercial biosensor, which is the pregnancy test, this is readily available. It can be used by anybody without any training, and it gives, certainly with a digital interface, very, very clear results. Now, my research at Bath is really about a part of it is about the design of the electronic tags that get used on these biosensor platforms. So we use an ion complex, a ferrocene derivative, which can be attached to biomolecules. Now, the recognition component that we normally use can be fragments of DNA, proteins, or even very specific polymers. And we can tailor the ferrocene derivatives themselves so they give different signals. So they're very much dependent on what's connected to them. And as they recognize a target, they can give specific signals. And if we have different ferrocene derivatives, we can get unique signals, allowing us to detect multiple targets. Now, we've taken some of our electronic tags and we've attached them to a specific sequence of DNA that can recognize chlamydia and can recognize gonorrhea. And this is now being worked up into a specific test for detecting bacterial infections, either on their own or co-infection. Now, we're working with Atlas, which was a university spin-out, and to commercialize this test. So the idea is that what we do is we take a microfluidic card, which is disposable, and we can take our clinical sample, extract the DNA, amplify the DNA, and we can do our test in about 20 minutes, and it should give a real clear example whether the sample is positive or negative for these bacterial infections. And we can give an instant readout to whoever's taking the test, and that means we can treat it very quickly. And the rapid treatment here can lead to lower infection rates in these very, very important infections. But of course, that's not a handheld device. And we're very much working, because it's an electrochemical test, it can be very much worked towards miniaturization and becoming a handheld device. But at the moment, it's not. So I think the $10 million is safe for now, and I think you're more likely to see this very elegant Starship Enterprise pizza cutter under your tree next week, rather than a prize-winning medical tricorder. And that 5 minutes went a lot faster than I thought it was going to go.